Hello, welcome to County Connections. I'm Judge Houston Wells. Today we have a special guest from the Franklin County Health Department, Sally Bruner, a nurse administrator here with the Health Department. And we have an issue in Franklin County that has just occurred, and that's with hepatitis. Today we're going to talk to you about hepatitis and explain some of the situations and what causes hepatitis. Sally, thank you for being here with us, and tell us a little bit about hepatitis itself.
Okay. Thanks, Judge. Well, there are different types of hepatitis. There's hepatitis A, B, and C, and actually there are probably more than that to go over, but I just wanted to clarify what those are and the one that we're most concerned about this week. So hepatitis, first of all, hepatitis B and C are bloodborne infections of the liver. It's a virus that can be transmitted into the blood through someone else's blood, probably either a needle stick or in caring for a person where you have contact with blood or body solutions and the virus is present, then you can contract hepatitis B or C. Hepatitis A, however, is the one we were going to talk about today, and we have had an increase in this infection. It is still a virus that affects the liver. It makes you feel very sick. Some of the symptoms of hepatitis A are having a fever, being jaundiced where your skin is yellow or your eyes, the whites of your eyes become yellow. Your urine gets very dark, and actually your stool gets very light or pale. And you usually have diarrhea and abdominal pain with this kind of virus. So hepatitis A is spread through infected people who is possibly not washing your hands completely. So it's a hand-to-mouth kind of contamination. So That is possible, yes. So hand washing is like paramount. That is so important, whether you're at home or you're in a restaurant. Despite how you're preparing food, you need to have good hand washing technique. Most of the restaurants, or all of the restaurants, go through food handling preparation and training. So there are times when they wear gloves, and there's extra precautions taken about to prevent a virus from being spread. So unfortunately, it did happen in our food service area here in Frankfort. It's happened in other counties surrounding us, so it's not something rare or new. However, we do take the extra precautions to make the public aware that the best thing to do is to get the hepatitis A vaccine, because you can get protection from this vaccine. It's a very simple thing to do. It is covered by insurance. If you don't have insurance, we have vaccine at the health department that is provided for the uninsured. So that is the treatment, or the prevention, I should say, for the hepatitis A virus.
Okay. And so is it possible that somebody might have it and not know that they have it, and then that's how they would pass it along? Is there kind of like a stage of where it is you're not sure you have it, and is that how those kinds of things get spread? Which to me means we all better be cautious and do due diligence on trying to spread it. Yeah,
so viruses do spread from person to person,
right?
Very frequently, just like the flu virus, and that's why it's so important to have the hand washing in place in the schools and in wherever you live and work to prevent the spread of viruses. So it is that that there's that risk of person-to-person transmission.
A lot of us, in every place we go, we see hand sanitizers. How effective are those?
They're effective, but there's nothing better than good old soap and water and good friction. So in the absence of having the sink and the soap and the water there, then using those hand sanitizers is good. It's, in and out of different buildings, touching doorknobs and work surfaces and things like that. So we have quite a few around in the health department as well, where you can wash your hand, use the hand sanitizer really quickly. But there's nothing better than using soap and water, 20 to 30 minutes, scrubbing your hands, especially before and after the bathroom. Or
20 to 30 minutes?
Oh, seconds.
20, 30, okay.
30 seconds. You're right. That's a long time.
Okay.
20 to 30
Okay.
seconds of
Okay.
washing things.
Okay, all right. But hand sanitizers
Number
do
one
work.
on all the viruses. I mean, really. And then we do have these vaccines. So flu vaccine, hepatitis A vaccine, they're meant to help us stay healthy.
Okay, before we go, a couple of other questions. You talked a little bit about hepatitis C, and that comes from touching bodily fluids.
Usually blood or body secretions that have been infected with this virus. So that when we don't have a vaccine for, unfortunately, there is a vaccine for hepatitis B, which we give to children and adults, but children do get that in the first year of life, the vaccine. But hepatitis C has no vaccine. So that is seen more commonly in people who use drugs intravenously. It's a risk for healthcare workers or first responders who deal with people in life-saving manners, where there's blood, possibly blood.
Right. That's why every one of them use plastic gloves.
Yes. So it's important also, and hepatitis C is it's a problem within our country, not just our state, but it's recognized with the opioid epidemic that's going on.
Okay. So, for the audience, if they want to contact the health department, maybe they could feel something's going on, or they want to get a vaccination, how do they do that?
We take walk-ins for a lot of vaccinations, especially the flu season right now. That's a walk-in status. Right now we also take walk-ins for the hepatitis A vaccine, but you can also make appointments. I will point out that all the pharmacists in the area also carry the vaccine, so you can easily get it at a pharmacy. Of course, your doctor's office is another resource. If you are sick, if you have this abdominal pain, fever, nausea, vomiting, and changes in, feeling sick like that, you should go to your doctor or the hospital if you need to go to the emergency room. But it's not a guarantee that you've got hepatitis A, you've got a virus. But we need to control the hepatitis A virus. We need to not let the outbreak grow as it has in other parts of Kentucky.
Yes, and in our country, we've seen several major restaurants that have had an outbreak of it, and through some type of food or something, haven't we?
Through the hand to mouth, yes.
Yeah. Interesting. Well, give the address and the phone number of the health department for our audience.
Sure, it's 100 Glens Creek Road, right here, Franklin County. And our phone number is 502-564-7647. That would be the clinic number, and you're welcome to call anytime.
Sally, thank you. We appreciate that, and I hope you all, as you watch, learn something today about hepatitis and how to prevent it. And you've been most helpful, and this was such pertinent information for us today. Thank you. Thank you, and thank you for what you do at the health department as well. Thank you all for watching. We hope that you will like and share our program. Thanks again for watching County Connections.